Okay, I give it 1 minute and then we'll start. We'll let the last ones to join us. Okay, so good morning, everyone. Thank you for joining us today. For those who doesn't know me yet, so my name is Nava Getahun. I'm serving as the Trade Commissioner at the Embassy of Israel, and I'm leading Israel's trade mission to South Africa. The Economic and Trade Mission is a specialized department of the Israeli Ministry of Economy and Industry, operating within the Israeli Embassy of Israel in South Africa. And our main mission is to strengthen the trade and investment ties between the two nations by connecting South African enterprises and key stakeholders with innovating and cutting-edge Israeli technologies. So it's really a true pleasure to welcome you all to this webinar where we can dive into the dynamic and evolving healthcare sector in South Africa. So today we will explore the unique opportunities and challenges this market presents and discuss how Israeli solutions can address critical needs and create impactful collaborations here in South Africa. The healthcare system in South Africa offers immense potential for innovation, from digital health technologies and advanced medical equipment to transformative partnerships. So it's a really market full of possibilities for those who are ready to engage, to adapt, and obviously to deliver value. So I encourage you all to participate actively, ask questions, share insights, and really envision how your expertise and solutions can make difference in this exciting landscape. I would like to extend my sincere gratitude to our partners at the Israeli Export Institution, Karin and Alberto Spiciano, and also Adi Salem for their invaluable supporting in planning and coordinating this event. And obviously, a special thank you to Charmaine Hirschowitz, who's managing the life science sector in our office and worked really hard to ensure the success of this event. Thank you, all of you, and thank you again for joining us today, and I hope you enjoyed this webinar. So yeah, let's start. Karin.
Karin.
Hi, everyone. Thank you for joining. Thank you, Nava, for hosting this event. Thank you, Charmaine, for all your hard work. We know how hard it is, especially engaging with the Israeli companies, but also I can only imagine engaging with the local key players, bringing the people in, Jason, Dr. Beira, to speak to the Israeli companies, explain a bit more about the nature of the South African health system and innovation. Basically, the Israel Export Institute, its aim is to promote export of Israeli companies, which I'm sure is something that's familiar to all of you. And we work in various sectors. I'm in charge of health. And this webinar, apart from being something that is super important to us, and as we see it, exploring and presenting the valuable options that there are for Israeli companies in breaking into the South African and working within the South African market, which is a huge valuable market with tons of opportunities for companies, for startups, for small innovations as much as big ones, for small changes just as much as the larger ones. We see it as very valuable, and we cherish this event, especially when working on a roadshow to South Africa in February for Israeli companies to meet with South African local key players, both insurance companies and other companies that are able to promote and insert and actually deploy Israeli technologies and generally technologies to develop themselves and support the operations and systems they operate for local people, suppliers, providers, citizens, and other users in South Africa. South Africa is not perceived as the land of innovation as we see it, and I'm not saying it's something we don't necessarily know, but this is our time. This is our opportunity to put a spotlight on South Africa and the opportunities it entails for companies in general. Usually, the go-to markets are the markets that are most hard to penetrate. But South Africa is both close and is an English-speaking country, so it is easier, or I wouldn't say easy as easy, but it is something that comes more to mind when thinking of countries to deploy technologies in it. I know that there's a great willingness to deploy and implement new technologies to serve the people who use the health systems in South Africa. We know that there's a great inspiration for innovation among some of the systems, and I am always happy when Israeli companies and startups begin to think of South Africa as a destination. We know there are quite a few Israelis already based in South Africa, both as a gateway to Africa and generally because it's a lovely country. But just saying that this is the place to ask Nava, Charmaine, everyone attending as panelists to bring up your questions, bring up your concerns. I know that I've texted some of you about concerns about getting into a new market, about a market that politically or diplomatically may be slightly different than other countries. But this is your time and our time actually to, I don't know if dissolve, but at least talk about those concerns that are usually not talked about. It is recorded, but it is a closed session. So please feel free to bring up any questions at the end that may reflect concerns. We are all here to support your efforts, whether here in the webinar, whether in February in the roadshow that we'll carry out to South Africa, whether generally in your communication with Nava, with Charmaine, and getting into and applying your questions on ERM for and about the South African market. Please feel free to reach out to any of us regarding it. We'll be more than happy to help. I don't know if questions should be in the middle or at the end. That's for Charmaine to decide. She's our boss today. I wish all of us to have a very fruitful event, full of information, opening up our minds to new business opportunities and innovations and initiatives. And I'm looking forward to hearing questions and communicating with all of you later. Thank you so much for hosting this.
Thank you, Karin. I'm Charmaine Hershowitz. I head up the life science sector at Israel Trade South Africa. Welcome all to this webinar. I hope you've gained much from it. And please, as Nava said, could you write your questions in the chat box, and we'll see as we go along when appropriate to answer them. And I'd like to introduce first speaker, Dr. Brad Beira, Medicolegal expert, MD of the Advisory Group and Secretary General of the World Federation of Chiropractors. He'll be giving an overview of the healthcare industry in South Africa. Our next speaker would be Jason Bloom, VP Sales of Bina.ai, an Israeli AI medical company, medtech company, and he'll discuss his experience of working in the South Africa healthcare system, the do's and don'ts and challenges he might have experienced. So without further ado, Brad, stage is yours. The camera is yours. On mute, Brad.
You know, I miss the days of you commute, where I would come to you and we would have a conversation. And we've gone from you commute to you're on mute. And Karin, your background, which is the cardiac cycle, the P-curious T, it actually creates T-wave stress for me. I actually feel the chest pain when I realize I'm on mute. So apologies. Quick question, and I'm very insecure, so I need lots of feedback. Can you see the screen? So yes. You can see it says health system landscape. I'm going to caveat this presentation by saying I'm new to the SA health system. I've only been seeing patients here since it's now my 31st year. and I was in practice before Google. And I like to say that in context because back in my day, if I wanted to do a blood pressure, I would need to take out my mercury sphygmo. I would put my stethoscope in, I'd pump it up. Hopefully I could hear out of both ears and I could do a blood pressure. Now I have an EDAN patient monitoring unit that does my SpO2, my mean arterial pressure, my temperature, runs a cardiac tracer, and does the blood pressure, and it exports that into my electronic medical record in real time. So the world has changed. What I'd like to do over the next 15, 20 minutes, and feel free to stop me, I'm going to just show you what the landscape looks like on the African continent, within the African Union initiatives to 2063, and what's going on in South Africa. So I've been involved in health transformation in South Africa since 1993, and I'll share some of that insight with you. So do stop and ask me questions because I think it's important. The first question, and this comes up often, this is a picture that I took on the Namibian, Angola, Botswana border, doing some of the nonprofit work that we do. And we had a Swiss team that was flying in. They were bringing in specialists. We were working in collaboration with the Namibian government on uplifting peri-urban and rural care. So the question that we ask ourselves now, and that dongle, that was an ultrasound that we were able to do, and we were beaming that back to Zurich and Bern and getting live second opinion inputs while the clinicians were on site in a tiny little area called Andara. And those of you that know Andara, it's just sand with a sign that says Andara, and there's a beautiful hospital. It's got an X-ray unit, but it doesn't have a plug, so there's no three-phase electricity to run the X-ray unit that was donated there. And that often, for me, is the context of where we are. So as we start looking at WHO's alma mater declaration, health is a state of complete physical, mental, and social well-being, not merely an absence of disease. And you'll see as we go through the slides, the entire South African health architecture is around detection, prevention, intervention. We recognize the curative and rehabilitative nature and how important they are. But if we can't see who's ill, how do we intervene? And so the question as we move into this digital ecosystem of how we define a consultation, and then once we've defined it, is a virtual consultation part of value-based care? Because when we start looking at universal healthcare, quality outcomes, value-based care becomes increasingly important. And then is telehealth person-centric? Is it interoperable? Is it sustainable? Especially in a world, and South Africa is no different from being outside Boston or being outside Prague or being outside any country in any city in the world where you've got intermittent data bandwidth. If you don't have bandwidth, you can't do telemedicine. If you don't have bandwidth, you can't do telehealth. So what's the relationship between the bandwidth providers, the medical device providers, and the FHIR interfaces that need to allow those things to connect? So when I started doing this a couple of years ago, I was based in Prague for a while, and we started looking at what telehealth and telemedicine around the European Union and Commonwealth would look like. And we then started looking specifically coming out of the restrictions of COVID. What were we seeing telehealth trends to look like, and how did we forecast it until this year? And there are some areas where you just can't do telemedicine, but you can do digital interventions in a remarkable way. So ophthalmology, very hard to do telehealth on a remote consultation view, but you can't do LASIK surgery without digital efficiencies and technology excellence. Psychiatry, psychology, to a large extent endocrinology, you can do remote virtual consultations. But on the other end, when we start looking at neurosurgery, general surgery, orthopedic surgery, and ophthalmology, the efficiencies and excellence of robotic care on laparoscopic and arthroscopic enabled enhancements for visualization and engagement fundamentally changes outcomes. So whilst we look at trends of utilization of telehealth, we need to be quite clear in our minds when we talk about the digital health system, what actually are we talking about? Because depending on the words we use, they can mean different things to different users in different tiers or sectors within the South African economy. So I just because I'm a male and I'm very insecure, can somebody give me a thumbs up and tell me that they can hear me and this is making sense? Charmaine, feel free to do it if it's you, because I can see you. Karin, I can see you too, Karin. So my trace is still working, right? So what does health system integration look like, both from a WHO perspective and from a health ecosystem, as it affects the South African markets? And when I say South African, I also want to talk about Southern African, and I want to talk about SADC, and I want to talk about BRICS, and I want to talk about the African Union, because you can't separate these markets from each other because of the international trade agreements. So fundamentally, there's components here on digital alignment, cognitive planning, and quality sensing. So we look at service delivery, but service delivery relates to and needs a health-based workforce. One of the challenges when we start looking at our health-based workforce within this subcontinent and this country specifically is and I'm using Charmaine's term of a two-tiered health system. 9.6% of GDP spend is spent on healthcare. 4.9 of that, in other words, slightly more than the majority, is spent in the private sector, with the majority of clinicians servicing 8 million people. 4.1 million is spent on 60 million people, with the minority of infrastructure, with the minority of support. And that disequilibrium is a major drive on government spend, on Department of Health initiatives, on legislation and regulation to try and drive throughput of access to care. So we see that here in the health workforce. We have 2,500 specialists, 14,000 GPs, and the lowest amount of doctor to healthcare worker to population ratio on the continent. And that's significant because we see burnout, we see economic disequilibrium, and we see pricing disequilibrium that affects the workforce and the access to health. That also then affects the use of medical products and device technologies. So when we're looking at digital alignment, it's not only that we have a workforce, but is that workforce young enough, adept enough, old enough, or agile enough with the right degree of illiteracy, which you'll see on the health ecosystem side, to adopt the technologies. When I started speaking about health technology transformation, I had a colleague of mine who was one of my mentors. He said, you will take the pen from my cold, dead fingers before I use electronic health records. And still now, the majority of practitioners use a narrative, scripted record. So the journey towards adoption and the journey towards using technology devices and the journey towards using remote monitoring and remote devices is a journey that needs as much education as it needs sales. It's one thing saying, yes, there's a market, it's massive, but the consumer market is actually not 60 million, it's 2.5 million. If you wanted to get to 60 million, you've then got to look at the financing component of that, of how are you going to create subsidies for the adoption of wearables, for the early detection, prevention, or monitoring. So that then brings us into the governance component. And incidentally, these 6 slides is only like a 10-hour lecture. We're going to cram it into 8 more minutes and then make space for questions. On the opposite side, where you can see the health ecosystem, when we look globally at the health ecosystem, it's very relevant here as well. E-health governance and legislation, standards and interoperability, the idea of interconnected telehealth, telemedicine, and electronic records, which are often used interchangeably, are really important. And with that on the other side, I think singly for me, as you consider coming in here, is the regionalization and then the use of and the understanding that for any adoption, the big data is important, but more important than the mHealth services and devices is the illiteracy, both of the patient and the community and of the practitioner and the health service delivery. We have a remarkably low illiteracy level that I think you need to be mindful of as we move forward. So what does our health strategy look like? I said to Charmaine, I'd give you a 30-year view. And she said, no, just can you talk about where we are now? But knowing where we come from is important, because the National Health Plan of 1994 was followed very quickly by a white paper on the transformation of the health system. If you look at National Development Goals 2030,
It's chapter 10, in case you don't want to read the whole National Development Goals. And you look at the content, it mirrors the content of the transformation of white paper from 1997. Out of that 1997 journey, it was early detection, prevention, maternal health, child health, infant health, addict-related care, communicable diseases, non-communicable diseases. In fact, the only subgroup not mentioned in the entire journey is the health of the male. Everyone else is represented except men. We can just die. But what came out of that was the National Health Act, which speaks about the user. They no longer talk about the patient. We talk about the user. And that was revised in 2013 to establish the Office of Health Standard Compliance. Why that's important is Sub-Sahara, we've got two organizations that look at health standards in hospitals and clinics, OHSC and CASASA. CASASA looks at the private hospital groups, OHSC looks at the other. CASASA did 50 audits last year in hospitals. I know because I chaired CASASA for many years. OHSC did 782. Gives you a sense of this, the disproportionate scale between private sector, hospital access, and public sector. Off the back of that, recognizing the journey and preemptive of the digital health strategy was the South African Health Products Regulation Authority. They came out in 2018. You cannot bring a device into this country for wholesale distribution in the health system unless it's registered, accredited, and approved by the South African Health Products Regulatory Authority. What's good for you to focus on as you move forward and to recognize is we have two presidential health compacts aligning the Sustainable Development Goals, especially 3.1, to the universal outcomes of universal health, to the finance, the budgeting, and the investment in health transformation. We have a digital health strategy for those of you that would like to read it, the 2019 to 2024 strategy, which aligns to the WHO global strategy on digital health, and it aligns further to the National Development Plan. So I'm sharing this with you because for those of you that learn by reading, I think it's really, really important for you to get that context. Am I making sense? I'm hoping so, because I can take simple things and make them complicated really, really fast. So when we look at Africa, Africa is following this digital, what's called Agenda 2063. It's Africa-wide. So if you're looking for where the opportunities are, the 4 top published health goals for the country is to increase average male and female life expectancy at birth to 70. That includes the progressive improvement of TB treatment. And with TB treatments comes all the antiretroviral issues, the 95, 95, 95 initiatives of HIV, the detection, the monitoring, and the testing. It includes also the issues around vaccinations for all appropriate care, reducing maternal, infant, and child mortality, significant investments in that, and then finally, significantly reducing prevalence of non-communicable chronic diseases, diabetes linked to obesity, heart disease, hypertensive-related issues. So much so that if you want to read on that, it's the PHC 101s, the Primary Healthcare 101 initiatives that were published in 2014. If you're going to drive those trends to get to universal healthcare, which is the primary stated objective of the President's Health Compact, there you want to look at how you're going to affect and measure the social determinants of health, how you're going to reduce the disease burden through devices, interventions, testing, and ultimately access to treatment, how you're driving that raise in life expectancy, and how you're preventing and controlling disease. So some of this is preventive, some of it is primary care, some of it is curative care, but the global journey within the subcontinent and sub-Sahara is the looking for partners to provide access, value-based, evidence-based, empirical-driven quality outcomes at affordable prices. So I'm going to pause there because Charmaine said to me, only talk for 20 minutes. So that's 20 minutes, if you can believe it. But I'm open to questions, anything that you'd like to know, any way that I can help share information with you. And you're welcome to call me or write to me at any time. I'll deny everything I've said, but I will help. So I'm going to hand Charmaine back to you, and I can answer any questions or participate in the discussion.
Are there any questions you'd like to write in the chat or open your cameras? No questions? Okay.
I don't see that we have at the moment, but maybe let's hear some insights maybe from Jason, as I would say, as from the experience of an Israeli company who made it in South Africa. So maybe you can share with us a little bit about the opportunities, the challenges, the time that you were working in South Africa.
100%. Thank you, Nava and Charmaine. Hello, everybody. My name's Jason Bloom. Originally from South Africa, 16 years ago, and obviously living in Israel. And for the better part of over 10 years, I've been sending fantastic high-tech solutions and Israeli products to the South African market. Obviously, pre-corona and all that stuff, I was living on airplanes, flying a lot, meeting a lot of people, being there, feeling the country, speaking to people firsthand. That's all changed. Everything's on Zoom and digital now. Kind of like the telehealth situation that we have going on as well today. Medicine as well is turning digital, exactly like the world. Everyone's going to this Zoom business and digital solutions and digital health. And that's where we fit in quite nicely with our solutions, and I'll touch on that as well. But for now, our company is Bina.ai. We're a software solution, really, it's a SDK provider, really providing a piece of algorithm into existing solutions, into apps, web or phone-based, mobile-based as well. And we have some very strategic customers in South Africa that I'll touch on as well. In the insurance sector, Brad touched on earlier, he mentioned obviously there's about 60 million people living in South Africa, and the consumable market of that is 2 to 3 million. And I think he's spot on with that. It's obviously something to take into consideration as well. That 2 to 3 million is very advanced companies in South Africa, into innovation, into technology, into Israeli technology. I've worked a lot across many different types of industries as well, automotive, medical, transport, and you see how enthusiastic they are about Israeli technology as well. So yes, you're going to have occasionally the people who are going to ask questions about Israel. It's fine. We can answer them how we know to answer them. But for the most part of it, you're going to find that they're very excited to speak to us. And they have the knowledge that Israeli technology is very advanced and very good. And that therefore you see a good willingness for them to work with us. In my time at Bina, in nearly 3 years that I've been here, I've met, again, a lot of different types of companies in South Africa. We have partners, local partners in the country. It's always good to have partners over there as well that are local and can speak, and then have their contacts and their network that you can tap into as well. But we've got Momentum Insurance as quite a large customer of ours, even across the company that we have about 200 customers around the world. Momentum's up there, one of the bigger ones as well, South African based, and they use our solution for kind of wellness, and they have an app called Kimi that's incorporated in the Momentum solution, and Bina is inside that Kimi app where you're able to monitor your vital signs in a digital manner. So obviously, we're an SDK provider, so their app shows it as Momentum. It's all their UI, UX, and what have you. But the back end of that is, of course, the Bina solution inside. We work across different telehealth organizations and telehealth providers as well. It's becoming increasingly popular in that space. Doctors are looking to maybe make some cash on the side as well at night, take a few consults. We know as well for sick employees, for employees that can't go to work on certain days, that they have to have a doctor's note and they have to go to a doctor to get a consultation to say, doctor, I'm not feeling well, please give me my doctor's note. If you're sick, it's challenging to do that. If you need to book a doctor's appointments, you can't always get it on the day, or maybe sometimes it's the next day or what have you. So you see the need for digital health that's being increased as well, where employees that are not feeling well on the day, for example, we have a few use cases like this, can have a telehealth consultation with their doctor, get a doctor's note as well. The doctor can use Bina inside of it, of course, to monitor the patient's vital signs and get a good assessment of what's happening, and from there issue the sick note if they need to. In terms of do's and don'ts and what have you, again, because I think the world knows how fantastic Israeli technology is, use it to your advantage. It's a funny thing to say, but people out there are aware that there's good tech coming out of the country. There's good stuff, so use it to your advantage. Speak about it. Always use use cases, give examples, of course, as well. But the country in South Africa, they're very into innovation. They're very into technology. So they're not afraid to try it out. They're not afraid to implement it into their solutions. And I've had tremendous success working in the region and in the country that over the last 10 years across different industries as well. Challenges, of course, is the exchange rate. You have to show flexibility in price when working. Israeli high-tech companies technically tend to charge in US dollars, and the US dollar to the rand is quite a hard currency for them. So you have to show willingness on the pricing, and that obviously helps close deals as well. That's it from my side for now. I'll be happy to answer any questions if they are. Hi, Karin.
Yeah, Jason. We talk a bit about the public and private.
Yep. Sure.
You're not engaging in public?
No.
Not at all? No.
Not in public.
Is any of your technology gone there via white labeling?
Not yet. The public health space for us is a large market. It requires bandwidth, and as Brad touched on as well, we need very simple mobile phone devices, and from the way we see it is that Bina was created to basically monitor vital signs for people who don't have access to medical devices. So the public sector is a massive sector over there. A lot of South Africans, so to speak, across all different markets and demographics and what have you, have smartphones. So they are able to use these solutions via the insurance companies, but obviously, via the states. We're not up to that yet. I've targeted private to begin with, but there's a massive opportunity there for public, of course.
And lately, have you fielded any negativity against Israel in your current clients?
I did have one insurance company who doesn't work with us. She actually set up a meeting, surprisingly, to talk to me, and I said, okay, let's see where this is going to go. And of course, it was about the conflict. That's all she wanted to discuss. So I don't talk much about it to my customers unless they're willing to really kind of have that conversation. I try to focus more on the positive and just more on business instead of any conflict. So yeah.
Absolutely, we do the same.
Yeah. No, but I really think it's an interesting discussion. I mean, I'm referring to your last point specifically because maybe also Brad can maybe add from his experience, but I feel I don't feel, I know the past year was a bit challenging when it comes to South Africa and Israel relations, and I know that a lot of Israeli companies are a bit hesitating when it comes to this relationship. So I see that we have two questions.
However, Nava, just before those questions, sorry to interrupt. I will share experiences of some of my customers actually apologizing for what has happened. So again, don't be ashamed or afraid to say that you're from Israel, because obviously it depends who you're speaking to, but the majority of the large corporations there are allies or friends of ours. So yeah, sorry.
Do you have an Israeli anonymous attendee? Do you have an Israeli faced, or it's something that you are keeping on a low profile? How stable is the infrastructure? Is cloud, Wi-Fi? From Karin. And can you explain about relation between payer, insurance, and patient?
Yeah. The first one's probably for us, Nava, but are we pretending we're keeping a low profile, or the companies?
We're not keeping low profile. I mean, it's very out there that we're representing Israeli companies. As I agree 100% with what Jason said. Eventually, we're focusing on bringing value when it comes to technology, and we're focusing on business solely. We're not focusing with everything that has to be with political aspirations or who do you vote for in the last elections. So I think that once the conversation is focusing on business and business solely, so the discussion will just, move forward from this point. So no, we're not keeping low profile. It's very out there. It's very clear. And we're always happy to cooperate and to partner with everyone who's in South Africa who's agreed to do business with Israelis. And those who don't, it's their loss. But as Jason said, I mean, people are interested, companies are interested. There's a huge keen to innovation, Israel innovation specifically. So yeah.
Brad, how stable is the infrastructure, cloud, Wi-Fi, depending on area?
I thought you were going to say, how stable am I?
How is your chair? Is it moving?
My chair is moving. We have a remarkably good digital infrastructure and cloud access, internet bandwidth network, but it is not what you know in the European Union. Our download speeds are not the same. So we have reasonable access, 3G, 4G. When my 5G router wasn't working, they said, you need to point it only in this direction, otherwise it won't work. So we have a multitude of primary providers. We have enough stable bandwidth to be able to stream. We've got both fiber and Wi-Fi. So fixed on fiber and router based. I don't think, I know it's sufficient in certain areas for robotic based high definition video and digital streaming up to my partner always laughs when I say 1080. I think that's really good. And now we're at double that. And so there's enough bandwidth for that. But you've got to make sure also that the areas that you're going to be working in have the stability to manage that. The network towers are there. We've gone through periods of load shedding, which then does affect the Wi-Fi when you off fixed line or when you off fixed fiber. But largely, I would say we probably a 6.5, 7 out of 10 in terms of stability. There was a second question that was asked.
Brad, I'm bombarding you.
Yeah.
The relationship between, sorry, Brad, I beg your pardon.
No, go ahead.
Okay. The relationship between payer, insurance, and patients. The elephants in the room.
I think it's good. And it depends what you want, right? So the thing about private funders is you get what you pay for. So what we often see as a conflict is so firstly, there is an act called the Medical Schemes Act. It empowers a council called the Council for Medical Schemes. There are individual memberships, and you can buy up those memberships, and most people buy down because regardless of what people say, we're in a recessive economy, money is tight, fuel is increasing, and when people have to choose between fuel and food and school versus medical fund, they buy down on the cover. Part A. Part B, the majority of tension that I find is on an elective surgery or the elective adoption of a medication that may or may not be well indicated for that condition. And then you start seeing arguments and funder advocacy. But generally speaking, the private cover
And you've only got roughly 3.5 million primary lives on the insured or a funder relationship. The biggest ones are the government fund, which provides fairly rich cover, and then you've got other funders. I think really the affordability of premium cover now is creating the health shocks that we're seeing. But funders, especially some of the ones I'm working with currently, are very early adopters of technology, of wearable devices, of home-based care, of hospital-at-home care, of interventive methodologies with virtual monitoring. So I think you'll find that warm. Where you will struggle is they're not waiting for you to say, come and sell us something new. Scalability, persistency, reliability are important. The separate accreditations are important because there's a lot of market pushback to say, are you selling things that you've got license to use in country? And the cost effectiveness and merit of that is important.
I think that's answered the how is home care visits. It's common. It's becoming common amongst the insurers. Am I correct?
Look, home-based care is increasingly prevalent. One of the schemes I work with have done it for more than 10 years. They got more than 27,500 people on active home-based care. That's diabetes, chronic obstructive airways disease, wound care, and other chronic communicable and non-communicables. Hospital at home, that step-down triage is increasing, and there's some adoption. What we're seeing with that is a tremendous interconnect between healthcare providers, hospitals, and funders to improve environments of care. And we're seeing that adoption, it's slow, very slow, but working.
Okay. In terms of BE tax, etc., I think that's a big question maybe to be answered offline. But my first go-to would be have a local partner who may have those certificates in place and rather open a South African company. But that's maybe we can answer it offline and put you onto professionals who know the exact rates. I would hate
potentially, but I would like to make a comment on that.
Okay, please.
We have very strong procurement laws, especially if you're looking at government-related work. You need to read an act called the PFMA, the Public Finance Management Act. And that will steer you towards what kind of ownerships you need if you're wanting to get into the broader-based government procurement systems.
Yeah. And yeah, I would take a guess there is tax and commission. It depends how you do it, but that would put you onto a special Forex lawyer.
Yeah, and with that, the Income Tax Act is quite specific on tax advantages for science and technology. You'll see on one of the slides, and Charmaine, through you, I'll share the slides with everyone. We are part of the science and technology innovation journey of Agenda 63, which is the Africa-wide agenda. So the South African Revenue Service provides significant tax incentives of up to 150% in year 1, 100% in year 2, and 75% in year 3 for science and technology investment into domestic operation.
I'll just chip in there as well. That when you're working with smaller businesses, I've never really come across the issue. Sometimes it's spoken about, but it's never really been an issue. With the larger enterprises and the bigger insurance companies as well, it's come up. We're not a South African entity, so it doesn't really apply to us. However, there's still sometimes inside of their insurance companies, they have local partners that they can kind of work with. So they can help you through that as well. Your customer can help you through that as well.
Yeah. And generally speaking, from time to time, we do host how to do business in South Africa. So this is where basically we'll explain in detail about everything that Israeli companies needs to know about doing business in South Africa. So as Tremaine mentioned, we'll answer if there is like something specific. So we'll be more than happy to answer offline, or you just you've been invited to attend our webinar that will deal specifically with this topic.
Jason, can you share an example of penetrating the market if there's an opportunity to get funding government or private.
Very challenging.
Both
Very
ways.
challenging. Yeah.
Yeah.
Government funding, yeah, it's very
Even private?
I've never seen
we're
it.
not, not VC based. We
Yes.
don't.
I wish that was the case. It
Yeah.
would make life a lot easier, but I've
Yeah.
never seen it.
Yeah. Rehab at home, part of the hospital at home care. So that is coming up. I see one of the large medical aids is using a special tech and maybe going to use an Israeli tech for that as well.
I've heard of subsidies around Europe where where there's a product fit, and I've heard also in Australia. Nothing's actually ever eventuated, but I've never heard of it in personally. I've never heard it come out of South Africa.
No.
Yeah.
Toothpaste and contract care, not a big area of. I wouldn't dive into that area. If I'm like consumables and that, I would rather go for the big tech and the standout trailblazing stuff. Consumables are a bit dicey, in my opinion. Not dicey, it's just they may get it cheaper. The quality may not be good, but yeah. Consumables for medical devices. I think, Brad, there's a new policy, or is that for digital diagnoses, reimbursement code coming from one of the leading medical aids.
That is still to come, and it will be device and condition specific. But there's a tremendous migration towards the adoption of device-based monitoring, remote diagnosis, and interventive care. And just on that, there was a question around hospice. We have a change in definition of the term palliation. So palliative care is no longer end of life just before death care. My context with that is I chaired hospice for 5 years before my current role. What's important to understand is that palliation is now any diagnosed non-curable medical condition. So if you have emphysema, if you have high blood pressure, if you have diabetes, that falls into palliative care. And so there are significant palliative care benefits, because palliative care on a condition that is manageable but not managed, that manageable but not managed leads to significant secondary health shocks and costs. So if you can be part of the journey that monitors, manages, and flags early patient deterioration, you become a very significant player in the health life cycle of a chronic communicable and non-communicable disease patient who's a person. And there's increasing funder adoption of those technologies.
I'm just looking at the consumables for medical devices. I've got a case in point, and they're trying to get it through one of the major health insurers, because it's almost a device, but it's a consumable, because you can't use the same one twice. So I haven't got the answer to that, but I don't think it's hard and fast yet. Brad?
Yeah, and it'll happen on a case-by-case basis.
Yeah.
It's like not all breast cancer medication is the same. Once you start getting into genetically specific or single-use adoptive technology, you'll need to appreciate, to the colleagues on the call, that those will have to happen on an individuated basis.
Yes, we've got one ongoing at the moment from Israel.
But there is a warmth to it, and I think it's important to say there is an interest in the sector. There's an interest amongst funders. There's also an interest amongst hospital groups. And we've got 5 significant private hospital groups that are investing in both in-ward and at-home monitoring for emergency room triage, for monitoring for pre-admission, and then for transportation with need for urgent admission on known patients. So if you've got capacity or you've got technology that speaks to those journeys, this is probably a really good time to be speaking to those procurement medtech teams.
Right. Yeah. Thank you. Any other questions?
If not now, you can always submit later. But I really, really want to thank both Jason and the other Jason, no, Dr. Brad Beira for making us time and to introduce us the healthcare system in South Africa, and obviously Jason to share from Bina's experience in South Africa. I think the participant gained a lot of knowledge and insights from your work in South Africa and the healthcare system. I'll just say that as always, we're based in Joburg, for those who doesn't know, and for those who are a bit concerned about the status of the embassy in South Africa. So we're here. Charmaine is here. Myself is here. I'm also here. So if there's any questions, feel free to reach out to me and to Charmaine and ask all these questions. Very, 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 very important to mention that South Africa is heading to their summer vacation. We're already in December, meaning Joburg is empty and everyone is basically driving down to Cape Town to enjoy their vacation. So
now's your time to leave, Brad.
Yeah, so it will be a bit hard to get a hold of the business and the companies in South Africa around this time because, as I said, no one is at the office. South Africans are taking their holiday vacation really seriously. So I would suggest that if there's any concrete or if there's anything specific when it comes to the South African companies, please send us the ERM or anything, I would say the beginning of Jan. So we're more than happy to assist. It was just a shame because no one will be at the office until the end of the month. And thank you again, Jason, Brad, and obviously Charmaine and Karin for coordinating this event. We're always here for anything, any concern, any question. As Karin mentioned at the beginning of the webinar, we're recruiting now companies to come and visit South Africa to a very special delegation to South Africa that basically will be tackling all these issues that Brad mentioned at the beginning of the webinar. So thank you again. The recording and the presentation will be sent out to you right after the webinar. Karin, anything else from your side?
Don't think so. Thank you so much, Jason, the Brad for introducing and speaking openly to us. It was great having you. And again, companies, people joining the webinar, attendees, if you have any questions, please feel free to reach out. We've heard about anything so far, so don't hesitate about bringing up your questions. Thank you.
Perfect. Thank you, everyone. Have a nice day.
Thank you. Yeah.
Thank you.
Thank you. Bye.
Bye-bye. Bye, Charmaine. Thank you.